Okay, finally, we're done with muscles. We have one table left. That is table 6-6, and these are the muscles of the abdominal wall. So the first two are easy because they're very similar to the intercostal muscles in terms of their fiber direction. So this first most external muscle of the abdominal muscles is the external oblique. And if you remember, oblique just means a diagonal. And you can see that the muscle fibers run down towards midline, which is the same as the external intercostals. So if my fingers are my muscle fibers, they run down like this. And then my internal obliques have mostly similar muscle fiber direction as the internal intercostals. So they're going to come up like this. So this is external intercostals and obliques and internal intercostals and obliques. And there is a mnemonic associated with this, and I'll let you ask your lab aide or your lab instructor what that mnemonic is, if they know it. If not, you can email me. So I'm going to hide this section. And the deepest muscle of the abdominal muscles is the Transversus Abdominus. And these muscle fibers are actually going to run in a horizontal plane. So they're going to go back and forth. So when one side of the abdominal muscles, excluding the rectus abdominis, well, rectus abdominis probably helps a little, but when one side contracts, it causes a lateral flexion of the vertebral column. And when both sides contract, it'll cause, you to do a crunch or to flex your vertebral column forward. So the rectus abdominis is this muscle that runs down the middle. Rectus just means straight. And you'll see that the rectus abdominis is kind of tucked away. You can see on this side, there's this white sheet over the top of it, and that is called the rectus sheath. And the rectus abdominis muscle is sandwiched in two layers of the rectus sheath. And the rectus sheath is basically an aponeurosis or a flat tendinous sheet that comes off of a muscle. Like we have one on the head, the epicranial aponeurosis, that's a part of the occipitofrontalis muscle. We have these aponeuroses that come off of the abdominal muscles, and they are going to engulf the rectus abdominis. So even though this looks like there's only one rectus abdominis, the other one is hidden behind the rectus sheath. So the rectus abdominis, when it contracts, it causes the crunching action, and I'm sure it assists with side to side. But where the rectus sheath comes down and it coils in on itself here, and this is called the inguinal ligament. So the inguinal ligament is the roof or the ceiling of the inguinal canal. So the inguinal canal here is where we learned that the iliopsoas muscle passes out of the abdominal cavity and onto the anterior thigh. We're going to learn that there are lots of blood vessels, there's nerves, there's part of the male reproductive system that is going to come out through that inguinal canal. And the inguinal ligament, it's not a muscle, so it doesn't have an action, but it's important structure to know in terms of the inguinal canal. And then the last term on your white sheets for the muscles is this structure right here. And this is the linea alba. And it's basically a fibrous bridge between the two sides of the abdominal wall. So the aponeuroses merge together, and then they form this little bridge of connective tissue that runs down the middle of the muscle bellies of the rectus abdominis. And this structure is important clinically, especially in obstetrics. So as a pregnant woman, her abdominal cavity is expanding. Instead of the muscles having to expand, the actual linea alba will expand. And after birth, hopefully that linea alba will come back together to its original position. But being that it's a tendon and it doesn't have a good blood supply and the same repair qualities as other parts of our body, sometimes it doesn't come back all the way. And subsequent pregnancies, it will get wider and then it'll come back less, and then wider and then come back even less. And when it doesn't come back together to its original position, it's called a diastasis recti. And as nurses, we are taught how to check for the width of the diastasis recti after birth. So we measure it like literally with our fingers, like how many fingers can we get in between the two rectus abdominal muscles. And again, that's the diastasis recti. So it is important clinically to know about this linea alba